A simple body scan could help identify potential health issues before you even begin to show symptoms. I had the chance to speak with Medical Director of Preventative Diagnostic Center about how you can take control of your health. One scan can save your life, and that's happening here at Preventative Diagnostic Center. I'm with Dr. John Pierce, and today we're talking about women's health and where high blood pressure and heart health kind of go hand in hand. At what age do you think a woman should really be kind of taking a look at these full body scans?
Well, we try to cut it off at around age 45 and older, up to around 75 or 80, really depending on the health of the individual. The reason that we don't want to scan women under 45 is reproductive health. I would hate for somebody to come in and potentially be pregnant and be exposed to radiation and then, cause harm to the fetus. So if they're still menstruating and there's a possibility they can be pregnant, we'd recommend that they don't do the scan until they're sure with pregnancy testing that they're not pregnant.
And why do you think it's so important for women to come in and get these scans?
Well, this scan allows women to really take charge of their health. And so if they're even asymptomatic, they feel good, but they have a family history or exposure to things like smoking and other types of carcinogens, or right, they could have heart disease and not know it, and now the scan would show it. They could have things going on in their lungs up to and including cancer. We could find that. They may even have some abnormalities in the ovaries or the uterus, and the scan would give some indication of that in a lot of instances that would give us a clue and then have them follow up with maybe a different type of modality to really kind of parse that out even further.
And you touched on the family history. What role does family history play in these scans?
Well, it's nature versus nurture, but if you grow up and everybody in your family smoked and you continue to smoke, well, is that nature versus nurture? But it's the family history. A lot of people smoke and they don't have a genetic predisposition to get that cancer, and other people absolutely do, so there can be that genetic component. So really, if you have a family history of heart disease or lung disease or cancer, something like that, and you want to know whether or not you have it at that moment or you're at higher risk, then the scan would be absolutely wonderful to do and give you that information.
And let's touch on the different scans that you do here one more time. We have the heart scan, the lung scan, but what else can you do here at Preventative Diagnostic Center?
We also do a full body scan. So basically that scan starts right around the thyroid and goes all the way through the pelvis. And so we're going to see any abnormalities in all the organs throughout that area.
So women, take charge of your health today at Preventative Diagnostic Center, because that first scan can really save your life. You can get a heart scan and calcium score for just $165. All you need to do is call the number on your screen or visit pdcenterlv.com.